When school closed in March of this year, there was so much confusion. The information came so quickly. What we were told did not always match up with what we experienced.
It soon became clear that although this coronavirus was new, the same old truths of racism and inequality were going to be reflected in COVID-19.
COVID-19 has been unfair. It has kept us apart. It has shown us national weaknesses. It has brought grief to too many.
During the shock and the grief, we have struggled to keep learning. And we have learned. We have learned that we need to appreciate each other. We have learned that we have strength. We have learned about this disease. And we are starting to learn about the path forward for learning.
As our community moves forward with opening up businesses, services, and schools in phases, we would like to share some of what we have learned since mid-March.
In March, we heard that people who were sick with COVID-19 would have symptoms that looked a lot like the flu and shortness of breath.
Now we know that many people who are infected do not notice symptoms or may not be showing symptoms at the times that they are able to transmit the virus to other people.
We also know that COVID symptoms can include not only fever, cough, chills, sore throat, shortness of breath, and muscle pain, but also
loss of taste or smell,
abdominal pain, nausea, vomiting, diarrhea.
A few people infected with COVID-19 can develop eye redness or bruising on the fingers and toes. It is important to check in with a healthcare provider if you are concerned that you have any of these symptoms of COVID-19.
We also know that recovery from COVID-19 can be complicated, as some people who had even mild or no symptoms with COVID-19 get better. They may suddenly have trouble breathing, become confused, develop a new fever, or have other symptoms that might be signs of more serious medical problems that need immediate medical care. Some symptoms can even occur a month after the initial symptoms. Some of them can even affect young children.
In March, we were told that it was important to stay home when we were sick.
Now we know that testing has become available free of charge in our community. Getting tested is one of the most important ways that we can prevent accidentally spreading COVID-19 to other people. We know that it is important to call our healthcare provider's office if we think we might have symptoms of COVID-19 so that we can get the best advice about when we should come in for a check and which of our symptoms might be more serious.
We know that it is also important to get immediate help for urgent medical symptoms such as chest pains and difficulty breathing. We know that the fear of becoming infected with COVID-19 has kept many people who needed urgent care for other health concerns such as heart attacks, strokes, and physical accidents from seeking life-saving treatment.
There is power in self-care. We all know our bodies, and we know we are not feeling well. We must not be afraid to advocate for our health. We must continue to take care of ourselves by making sure that we get outside and exercise as much as we can, by making sure that we are eating healthy as much as we can, and by making sure that we are supporting our sleep and mental health as much as we can.
In March, we did a lot of teaching and learning about washing your hands for 20 seconds. We also saw a lot of people using gloves.
Now we know that we have to think carefully about how and whether or not to use gloves. Gloves may give us the sense that we are protected, but we have to keep our hands away from our face and eyes. Whatever we touch while we are wearing gloves could have germs on it. We have to remember not to touch our face, eyes, or personal items with those gloves. We have to continue to wash our hands after we remove the gloves, after using the bathroom, before we eat, and after we come back in to our house from being outside. Remember that hand washing with soap and water for 20 seconds is still one of the best ways to protect ourselves from exposure to COVID-19.
We continue to clean frequently touched public surfaces carefully with disinfectant or soap and water. We know that touching a contaminated surface, then touching our mouth, nose, or eyes, our mucous membranes, could possibly transmit infection to us. Although this is not thought to be the main way the virus spreads.
In March, not many of us were wearing masks. The idea of wearing masks in public seemed unusual to many of us, and at that time, government health agencies did not recommend that we wear them.
Now we know that wearing masks in addition to physical distancing can greatly reduce the risk of exposure to COVID-19. Wearing masks works, but it works best when we all wear them.
Masks help to prevent someone who has COVID-19 from spreading the virus. Scientists and researchers believe that the main way that COVID-19 spreads is through tiny droplets that can hang in the air for minutes to hours after someone coughs, sneezes, sings, shouts, or even talks.
Masks also help to protect someone who doesn't have COVID-19 from inhaling the virus. Cloth masks do not offer as much protection as the one the hospital workers wear, but they are very helpful.
To work well, cloth masks should have several layers of fabric. We also need to keep the face mask dry, and we need to be able to easily breathe through it. Cloth masks must also fit us well. They need to fit tightly around the nose, the chin, and the sides of our face. One of the best ways to do that is to make sure the mask has a nose wire, and by checking the fit as we put the mask on. We need to avoid touching the mask while we're wearing it and when we're taking it off to eat or during an outside break. We need to remind ourselves not to touch our face, and you need to wash your hands frequently. We also need to wash these reusable masks and let them dry completely each time before we use it again.
When schools close, many of us have never heard the term social distancing. We talk about this virus with confusion and worry, but hope that soon we will be back to our normal.
Now we know that we need to protect ourselves and each other from COVID-19 until scientists can develop and factories can produce a vaccine. The new language of physical distancing reminds us how important it is to stay connected to the people that we love and value. Although we must stay apart from each other in order to prevent the transmission of the virus, we are depending on each other more than ever.
Because outdoor spaces have the best ventilation possible, they are one of the safest places for us to be outside of our homes right now. The wind and open space help to blow away tiny droplets that may carry COVID-19, so that fewer of them might reach our mucous membranes.
But even though outdoor spaces are safer, we know that we still need to physically distance by staying 6 feet apart, avoid touching the same surfaces if we don't live in or share the same household, and consider wearing a mask if you're going to be exercising, using public restrooms, or working outside closer than 6 feet from other people that don't live in or share the same household. We know that it's a good idea to bring hand sanitizer with us to clean our hands and to avoid shared play equipment.
Indoor spaces have less ventilation. It is especially important to follow guidelines for social distancing, pay attention to the number of people using an enclosed indoor space, and to use masks to protect ourselves and others.
Some of us knew back in March that COVID-19 would not affect our communities equitably.
Throughout the history of our country, access to income, health care, education, housing, and employment has never been equitable.
Now, we have all seen examples in the media of inequity related to COVID-19.
Not all of us have access to jobs that allow us to work from home. Not all of us have health insurance or access to a health clinic. Some of us have lost our jobs.
This is not an Asian virus, and Asian Americans are no more likely to be affected or transmit infection to others than any other racial or ethnic group.
No one should feel afraid to wear a mask in a store to protect themselves and others, or have a job delivering packages or food to other homes.
we should all have access to the personal protective equipment, running water, and other supplies that we need to keep our families and communities safe.
No one should feel that their access to the best possible health care is limited by their race, citizenship status, age, disability, health status, sexual identity, or gender.
Everyone should be able to have access to their education.
And that is why we, the staff of MMSD, are committed to supporting and listening to each other.
Our students.
Our families.
We hope that you have a safe and healthy summer.
And in this time of uncertainty, we hope that you will reach out to us with questions,
your concerns,
your ideas.
Because we're here for education and for health, now and in the fall.